Well, elective care itself is any form of care that is provided of a non-emergency nature. So that might be care that is planned between the GP or the clinician and the patient, that is in a routine manner, but actually is in the patient's best interest and for better health outcomes. In terms of the actual referral facilitation programme that we're trying to roll out, this is about looking at enhancing efficiencies while maintaining or enhancing qualities for that patient care. We accept that there is a huge amount of variation across the whole patch in terms of our referral processes, but also our approaches to patient management. Part of the idea of the Better Together programme is to actually try and standardise that to ensure that every patient has the best chance of getting the best quality care. There are several ways that we're going to try and do that. Number one is to try and introduce a standardised format for template and guidance for referral management. Now what that will include is identification of best practice guidance and trying to encourage and support GPs and other clinicians to follow that whenever they see the patient. The second approach is to identify key relationships within that pathway. Now the likelihood is that is between, say, primary and secondary care, in which case it's vitally important that we have those ongoing relationships with primary care and secondary care clinicians to enhance the pathways, to encourage feedback with our referrals, but also advice, guidance to ensure that the patient gets the most appropriate care. More recently, we've brought out the MidKent Pathways website. That has been produced internally, but actually is a mechanism by which clinicians can access any of the pathways that are available in their locality to try and help them and support them to manage the patient in the best way. These pathways are updated, they've got the latest guidance and also the relevant forms, so there's no more of this filing through cabinets and trying to find odd pieces of paper, but actually the information is right at their fingertips.
So the benefits of these processes to GPs are basically streamlining all of the processes that we have, stopping some of the problems where referrals get bounced back and have to be sent elsewhere, which takes up time with extra appointments in the community. Obviously a patient that takes longer to get to their final solution is not as happy as someone who goes through on a seamless process. So basically reducing some of the toing and froing that we currently have with some of the problems that we have in the current system.